Okay, in this video we will be going through the nerves of the thoracic limb, and we're going to start on the medial aspect and we will work our way proximal to distal. The first nerve that you can see here is kind of coming straight down and diving between the supraspinatus muscle and the subscapularis muscle. That's going to be the suprascapular nerve. We also see oftentimes multiple of these small nerves that are going to be going directly into the subscapularis muscle. Those are just going to be subscapular nerves. Next, just caudal to that, you'll see a fairly large nerve that is running deep from medial to lateral and also going or traveling very close to the caudal circumflex humeral artery. This nerve is going to be the axillary nerve. So oftentimes you will see the axillary nerve running parallel to and right with the caudal circumflex humeral artery. If we flip this leg to the lateral aspect and look just deep to the deltoideus muscle, this is where we will actually see that nerve coming out to supply the deltoideus muscle as well as the teres minor muscle. You can also see some of its branches going into the teres major muscle. So that's the axillary nerve. Next, you will see this nerve here that is traveling next to the thoracodorsal artery. That is going to be the thoracodorsal nerve. That will be traveling right into the latissimus dorsi muscle. Next, we will see, get that little nerve out of the way. We see this kind of common trunk right here that's going to be giving off or leading to the ulnar nerve, which is coming down here caudally. And off the ulnar nerve right here, we can see the caudal cutaneous antebrachial nerve, providing sensory innervation to the caudal aspect of the antebrachium. The other portion is going to be the median nerve, and the median nerve will be traveling down right on the medial aspect of the elbow, all the way down here to supply some of these flexor muscles of the antebrachium. We can see that muscle coming through and right there supplying the superficial digital flexor muscle. We can also see this nerve right here that is coming down and sending a branch to the coracobrachialis, as well as the biceps brachii and the brachialis muscle. This is the musculocutaneous nerve. That will be giving off right around here at the elbow, the medial cutaneous antebrachial nerve. Next, we see this very large nerve right here that is diving into the medial aspect of the triceps brachii. It's a very large nerve, and we see it splitting and going into the different heads of the triceps muscle. That's going to be the radial nerve. The radial nerve dives deep between the heads of the triceps and will come out here on the lateral aspect just deep to the lateral head of the triceps brachii, and it's going to give off two branches. It will give off your superficial branch as well as the deep branch. The deep branch will be diving deep into the extensor muscles of the antebrachium to supply motor innervation to those muscles, whereas the superficial branch will actually give off the lateral cutaneous antebrachial nerve to supply sensory innervation to the lateral aspect of the antebrachium. The only other nerves that aren't very well indicated here, with the exception of this nerve is going into the deep pectoral muscle. So that is going to be the caudal pectoral nerve, and a lot of times you'll see multiple of these. If you see a nerve going into the superficial pectorals, like these two little nubbins right here, that's going to be the remnants of the cranial pectoral nerves.